This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Hey EMM, we are excited to announce that we are now accepting applications for our second annual Diversity and Inclusion Award. The award is eligible to fourth-year med students identifying as underrepresented in medicine and are applying to EM residencies. We are extending 3 $200 awards to selected individuals following a blinded review of all applications. Applications will be accepted through the end of November, with winners being announced mid-December. Check out our website at www.emergencymedicalminute.org/EDI-award for all the details and to access the free application. Or you can click on the link in our show notes. Thank you.
All right, good morning, everybody. So over the last couple weeks, I've had a couple of sick patients who were cardiac arrests from the field in bad asthma patients. So I just want to talk for a minute about kind of ventilator management, specifically in bad asthmatics. When patients who have bad asthma or COPD have really bad bronchospasm and they're on a ventilator, it presents a whole set of challenges that we really have to kind of pay attention to. Asthma is not usually a problem of oxygenation or getting air in. It's a problem of ventilation and getting air out sometimes. When they're on a ventilator, it can be very hard to get both air in and out, and it can cause several problems. So the first thing is when you have someone on a vent, we need to pay attention to the ventilator settings. Sometimes they're a little different than usual. First thing is kind of slow respiratory rates, kind of lower tidal volumes, and you talk about lots of expiratory time to give them time to get their air out of their lungs. The problems are, if you don't let them get the air out and you just kind of keep bagging and bagging and bagging, their chests just kind of fill up with, air, what's called hyperinflation. And what it can cause is barotrauma, which is things like a pneumothorax. You can actually just pop their lungs from putting too much air in and not letting the air go out. And then you can also get basically cardiovascular collapse. You can get really bad hypotension or even cardiac arrest, because if their lungs are super full of air, then there's not enough room basically for venous return to come back to the heart, and they can get super hypotensive or even go into cardiac arrest. So the couple things to kind of pay attention to is if it seems like it's getting harder and their pressures are getting higher, then we need to back off on the respiratory rate, lower their tidal volume, and it's okay if patients aren't satting 100%. If they're down 87, 88%, that's okay. If their PCO2 is high, that's okay also. We really need to slow down their respiratory rate and lower their volumes. Another thing that you can do is if you find that someone's getting more hypotensive, things seem like they're getting worse, it's actually just disconnect them from either the bag or the ventilator, kind of push on their chest and give it time, lots of time, sometimes 30 seconds to get all the air out, and that can sometimes make things better. We need to pay attention if things suddenly get worse. Do they have a pneumothorax? Do they need a chest tube? Is something to pay attention to. And then, in addition to paying close attention to the ventilator, we need to remember that these patients still need lots of albuterol, sometimes continuous albuterol, Atrovent, over and over and over again, steroids, magnesium. Sometimes if everything we're doing is not working, we'll do things like Heliox, or they'll even put the patients on a general anesthesia circuit in the operating room. Sometimes that helps. But the bottom line is, we need to pay really close attention. It's not, basically just to put them on a ventilator and forget about it. It's actually, you need to pay super close attention to these patients when they're on a ventilator, because they can get sicker and sicker even when they're on a ventilator. All right, thanks guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.